Hello, everyone, and welcome to our webinar today. Thank you so much for joining us. My name is Dr. Boyles, and I'm going to be leading the webinar today on Beyond Meds and Therapy evidence-based supplements that boost mental health outcomes. So, one of my favorite things to do and is to read research studies. This is what I do at night. So, my spouse will have nonfiction books, and I am digging into research studies. I love them and I like digging past the headlines to see what data really says. And because over the years, I've learned that findings can be framed in a way to really support whatever story or author the marketer wants to tell you. And that's specifically happening with supplements right now. There's an explosion of supplements marketing. You see this on TikTok and Instagram and everywhere else. And they're promoting like better mood, sharper thinking, less anxiety with these supplements. And some of those claims are grounded in evidence, but a lot of them aren't. And there's no real regulations over the purity of supplement, the potency, and unfortunately, as I dug into this, not even the safety. And the reality is what is on the label of a supplement often is far from what's actually in the supplement at all. But there are really good supplements out there that boost mental health outcomes. And so that's why it's important to understand one, to find out what your patients and clients are taking. And then sometimes you can add supplements to prescribed treatments. And sometimes your clients don't feel comfortable having these conversations, so it's good if you have more knowledge on it so that they could see you come from a place of knowledge and strength and the facts and you can help guide them safely. So just to make sure nothing interferes with their care. So we're going to look today at the science. We're going to talk about the myths and definitely the marketing. So when you walk away from this webinar, you'll know what's real and what's not as far as a lot of these supplements. But it's so great to have everyone here today. Thank you. Some of our goals in the webinar is we're just really going to look at cutting through the noise. I have a lot of nice slides on this, but we're basically going to cut through the noise and really translate what evidence there is out there. And I'm going to share with you things that have been rigorously tested. All right. The evidence based insights and things like optimal dosing and safety considerations. Again, what the research really says about these supplements. So now one thing I do want to tell you that there are some numbers that you're going to see on the slides that I have, and we're going to go over a lot of supplements, but some of the numbers on the slides are going to be different than what for the recommended daily dosage of the average person. And what I want to be very clear about is the numbers or the figures on the slide, those reflect dosages that were used in the clinical research studies. And so if you look it up and you're like, that's not the recommended dose, it's daily. No, these are for clinical studies. Because again, this webinar is focusing on evidence from the actual trials. And I'm going to be presenting this was the amount done in the study, which is again going to be different from what a general recommended amount. So and the next thing, I want to make sure this is an active conversation. Like I'm going to be taking your questions in real time. And the questions that I'm going to give you are going to be scientifically grounded. So now, and I also want to be crystal clear, and we'll go ahead and get started after this. Everything we discuss today in here is for educational purposes only. I'm just here to strengthen your knowledge and sharpen kind of clinical judgment in this area. But this is not a replacement for individualized medical guidance. Okay. I want to be really clear about that. All right. So let's keep going then. One thing that with supplements out there, the quality and safety of supplements, it gets overlooked because unlike prescription medications, when you get a bottle and it says Wellbutrin 150 milligrams, you know that bottle has Wellbutrin 150 milligrams in that bottle. The dietary supplement and vitamin industry is not held to the same rigorous standards. Manufacturers don't have to prove that their products are safe. They don't even have to prove that they're effective or even pure when they hit the market. And that's what's on the label, again, isn't always exactly in the bottle. And formulations can be drastically different between the brands. Some products have far less or far more than the ingredient that they actually claim to be. And some of them have substances in there that you would never want in your body. And that's why you have to be really vigilant with that. You've got to read all the labels with a really critical eye, and you've got to cross-check for any potential interactions. So as a rule, what I will tell you is that you want to choose brands that voluntarily submit to independent third party testing and have seals from like reputable organizations. I've included some of these logos here. So when you look on a brand, you should see this logo. I will encourage you, if you don't see one of these logos, I wouldn't buy it. All right. And here's the problem. The seals themselves aren't a guarantee of like clinical effectiveness. They're just like this meaningful step towards ensuring that you're getting what you think you're getting in that bottle. All right. So the Consumer Lab, the USP, and the NSF International are all very reputable companies, and you want to check to make sure your supplements, all of them have this on there. There are also some additional third-party certification and seals. Like one I like is the non-GMO Project Verified. It just verifies that products meet the non-GMO standards, right? There's a few other ones out there. Here's another thing. Sometimes your supplements will say it's lab tested. Here's another to add another layer on top of that. Not all labs are accredited. So if it says it's lab tested, you want to look at the product and see, is it ISO IEC accredited labs? That means that the lab meets international standards for testing. But a lot of products will throw that on there. Oh, we're lab tested, but you're not lab tested by an accredited lab. So there are a lot of issues in this market. And so I want to be very clear about that up front. Very clear about that up front. But what we are going to be talking about is I'm going to give you some more disclaimers and then we're moving straight in. Okay. But I think that everything we discussed today is just intended to be a complement, not a replacement. What I'm trying to say is supplements shouldn't ever be positioned as this is a standalone solution. This is all you need to take. So this is all you need to take. I think that, and if you're considering any intervention whatsoever, you start at the lowest effective dose and you increase it gradually. And you only do one at a time. Don't start like 4 supplements at one time because then you're not going to know which one is actually working. That's starting slow, low and slow, low and slow, and just one at a time is the only way to clearly see what's helping and what's not. Let's see. Emily said, what were those initials for the lab? Let me see. I'll put that in here for the lab. This is what you want to check for the lab. There we go. All right. Yeah. Any questions you have? One of the things, like there's a tea that I drink that this is what it says on the box. There we go. This is the non-GMO Project Verified. That's another one. You also seen there's other ones that say certified organic, USDA organic, right? And that just ensures that the agricultural sourcing meets like organic standards. Not on a lot of fruits, but also you see it on supplements too. So yeah, no, great question. Absolutely great question. Another thing, getting back to the ground rules, if you always take an account pregnancy or lactation status, and another, because you've got to be especially cautious. You don't want to put something in your body, especially if you're pregnant or lactating. But then kidney and liver function are going to play a big part in this. And as I go over these, I'm going to keep talking about kidney and liver function because there is a huge potential for these kind of interactions with kidney and liver. And that's critical for safety. And then the last thing is just reassessing people. If you encourage certain medications, like I would assess them with a PHQ-9 or a GAD-7 every couple of weeks so you can adjust or discontinue. So somebody asked in private chat, do clinicians, yes, I'm going to answer your question and we can get into that a little bit later, but yes, I know therapists or counselors that absolutely recommend certain medications and that maybe have shops for that. Yes. Yes, to answer that question. Sorry, that was a private question. All right. We're going to move right on in. We're going to start with one that I love. It's the omega-3 fatty acids. And let me tell you why I love it. Okay. The research here is pretty fascinating on this. And it's not just about like fish oil is good for you, right? We've heard that. But when you look closely at the very rich omega-3 formulations, they carry a lot of weight in mental health. Like they have powerful anti-inflammatory effects They modulate activities in the body. They actually improve the neuronal membrane fluidity, and all of these mechanisms are directly related to mood regulation. And there was a really big study, and then this is an older study, I mean, it's 2019, but it pulled from 26 randomized control trials, had over 1,000 participants. The more participants in the study, the better it is, the truer the data. I hate looking at a study where it's got like 10 participants. That's not a good study. We have over 1,000 participants, 26 randomized controls, and the finding on that was crystal clear. Okay. That the EPA, not DHA, was significantly linked to reductions in depressive symptoms severity. And here's where it gets even a little bit more clinically relevant here. Those benefits were most pronounced in two groups, like people who had only had partial response to SSRIs and those with elevated baseline inflammatory markers. So, in other words, this isn't a blanket supplement for everyone. It's really a targeted tool, and it's especially useful in specific clinical scenarios. So, but fish oil is absolutely a wonderful supplement. Absolutely wonderful supplement. Let's go to the next slide. We'll talk about clinical dosing. I also like to talk about common side effects. There is GI discomfort with fish oil. All right. There could be like burping and heartburn and nausea. Some people it causes diarrhea, but a lot of people just report like an upset stomach. So some taking it with food a lot of times is very helpful for that. There are some taste and odor issues with like a fishy aftertaste, fishy breath, even sweat, like their sweat can have some odor to it. There are very few allergic reactions with fish oil, but there can be if there it's rare, but it's possible, right? And in prescription high dose formulas, it slightly increases liver enzymes. All right. The ALT and AST have been observed to be increased. So that's one thing. In some individuals, it did cause increased risk of AFib. That was rare, but when patients, if they had an underlying cardiovascular risk factor that did cause that. There are some things like prolonged bleeding times. So if you're taking fish oil, you need to stop it before you go to the dentist or you have surgery because it can raise your bleeding risk. And you definitely don't want to take it if you're on any anticoagulants like warfarin, like Coumadin, warfarin, aspirin, anything like that. It actually lowers blood pressure a little bit, which is if you're on an antihypertensive, you're on a medication for blood pressure, that could cause a little bit of problems, right? If you're not taking anything for blood pressure, you're going to be fine. But if you're taking medicine already for blood pressure, I would watch it with fish oil. And if you have diabetes, it might elevate your fasting glucose. So that you need to know about anticoagulants, antiplatelet drugs that co-use could increase bleeding and antihypertensives. And then with vitamin E, the omega-3s can deplete some vitamin E levels, which vitamin E is on my list as well. So we'll be going over vitamin E. But I will tell you that I used to work with a psychiatrist who always, when individuals came in through the behavioral health emergency department, the first thing that psychiatrist did was she had a standard regimen of medicine that she would use, but she always gave them fish oil, 2,000 milligrams per day. That was immediate. She put them on fish oil. Every single person that walks. And this was years and years ago, and she continues that practice today. But there's a lot of evidence, and there's a lot of good evidence for fish oil. So has anybody in here taking fish oil or has had patients that are taking it or knew about it? Yeah, there is definitely a link with glucose. There is. It might elevate that fasting glucose, which could complicate type 2 diabetes. So good to know. Absolutely. We have some people saying, yes, I have. Yes. I will tell you, as part of my supplements, I take fish oil every day. I do. And so I love that. I eat a lot of tuna fish. Yeah, fish in your diet is super important. And you don't have to take a supplement to get the omega-3s. If you have a really good diet, you can get them. You can absolutely get them. Very good. So I recommend it. A couple people recommend it. That's great. That's fantastic. That's fantastic. It's a really good supplement. It's a really good supplement. So fantastic. All right, let's move on. Great feedback here. We're going vitamin D. Look, vitamin D is another favorite of mine. It has a far bigger role in mental health than people, I think, realize because it's not just about like bones and calcium. That's what we hear about it, right? Vitamin D, you want to take vitamin D with calcium. No, it modulates this serotonin synthesis and also inflammatory signaling, which both of those are really critical to mood regulation. And there's a deficiency in vitamin D that's pretty common among people who have depression, especially during those winter months, right? But there was a analysis that really demonstrated moderate antidepressive effects from vitamin D. All right. And the story gets even a little bit more compelling with combination therapy. They did a trial that had vitamin D and they put it to fluoxetine. So they just added vitamin D to fluoxetine. And those people in that trial had significantly greater improvements than with just the fluoxetine alone. So this isn't just like stacking treatments. I think it's enhancing the underlying biological pathways that actually influence kind of recovery. So it's safe, it's cost effective. Vitamin D is generally not very expensive, but I think it's very clinically valuable as part of this broader treatment plan. It's a small, kind of low risk intervention there. Now, here's the thing. If you do take tons of vitamin C, it can cause nausea and vomiting because you can get into like hypercalcemia. And so that could cause kidney stones. So you have to be a little bit careful with your vitamin C. But, that's one thing. There are lesser known reported symptoms like dry mouth because some people like long-term use of it could cause dehydration. And so that's one of the things. Yeah, exactly. So let's see. You encourage your clients to take vitamin D to depression in the winter and omega-3, as well as magnesium. Randy, we're hitting magnesium as well. That's a perfect combination. Let's see. I'm sorry. I didn't mean to say your name out loud. There we go. I was taking vitamin D3 and K2 had blood and was so high. I was at risk for vitamin D. That is, you know what, Emily? Thank goodness you had your blood work done and went and got it done. But yeah. So vitamin D3 with K2 that is absolutely. So yeah, you don't want to be at risk for that. That is like, I was just talking about, I didn't see your comment. I was just talking about some of the problems there and what can happen. There are medications. I need to quit saying people's names. Sorry. Cause like I said, this is people, when they get the recording, they're only going to see the screen and hear my voice. So I'm sorry, but thank you for sharing that. Especially there are medications that can make that worse, like any kind of diuretic, digoxin, any calcium channel blockers. That if you're taking digoxin and have high vitamin D, it can actually cause like a fatal arrhythmia. So that's really important. One thing I need to caution on vitamin D, though, and I'm glad that you brought this up, is prednisone. It can actually interfere with vitamin D, right? So that's one of the things too, that in statins, if you're taking like statins, cholesterol, and you take vitamin D, that it'll reduce the statin's potency. So if you have really high cholesterol, maybe back off that vitamin D. So another thing is seizure medications. They can actually accelerate vitamin D breakdown. And what that means, though, it's not, you would need to take more vitamin D. Yeah, absolutely. Very good. A lot of good. Let's see. All clients refer to the doctors prior to starting supplements to ensure they're safe taking the supplements. Absolutely. Blood work is huge before. Absolutely. Absolutely. And I don't think that people do that quite enough. It says, I wish more doctors and prescribers and psychs would be more well versed. It's hard for me to find professionals to collaborate with this on clients. I agree. I hear that from a lot of different perspectives. So one, listen, let's just be really honest. There's not a lot of good studies on supplements. There are more coming out, which is good. A lot of studies are paid for by, like, when we have studies on medications, they're paid for by large companies, whereas supplements, let's be real about this, right? All of us in here we couldn't like start up a couple of you probably could. I see some really smart people in here. Start your own pharmaceutical company where you're making your own medications and coming out with medications and producing them. But it is very possible for quite a few individuals in here if you wanted to start your own supplement company and actually start producing supplements, like bottling them and selling them, because the regulations on that are really low. So there's not a lot of great data. And then the problem is because anybody can do it, they're not all created equally. Right. And so I see both sides of that. Absolutely. Good thing here, there seems to be a lot of confusion between vitamin D and vitamin 3 among clients. So, absolutely. That's a really important question. Vitamin D is derived from like plants and fungi, and it's often used in like plant-based supplements. And then vitamin D3 is synthesized in the human skin, right? So sunlight, think sunlight. Also, it's in animal sources like egg yolks, fatty fish, liver, things like that. And vitamin D3 is more effectively absorbed and retained and converted into the active form compared to D2. All right. And D3 can be a 87% more potent that a D3 than D2. So a lot of things there. Absolutely. If you have vegan or vegetarian patients, D2 is plant-based. Okay. It's just keep that in mind. But I will tell you the D3 is clinically superior. Okay. That's one of the things. So, all right. Well, see, there you go. There you go. D2. It's yep, absolutely. Very good. All right. All right. Great questions here. Let's see. We are going to send this out, so don't worry about that. If you signed up for this webinar, you will get this recording, and we do have handouts as well. So they have put handouts up at the top, so I encourage you to download those. So, yes, we got a lot of agreements here with it. It was a great comment. Absolutely. More people need to be more well-versed in this. Yeah, you have to advocate hard for certain tests. People don't want people the other I went in the doctor the other day because I was like, I'm having some like numbness in my hand. It's not a big, and I really had to advocate to get a B12 test. They wanted to run every test under the sun and not the B12 test. And I was like, I need a B12 test, please. And that it just depends. Yeah, absolutely. Absolutely. So no problem. I'm happy to give that. I have another question here. How does prednisone how does prednisone interfere with D? So with vitamin D. So how does prednisone interfere with vitamin D? It reduces the half-life of the vitamin D. So it yeah, so you got to be careful. It reduces that half-life. Yeah, that's how that works. All right. All right. So great questions. I'm going to keep on moving. We have a lot of slides here, so I'm looking at the time. I'm like, oh, you need to go fast. Was just talking about B vitamins. So I love B vitamins. I'll just be really honest with you. I think B vitamins are wonderful. That there's a doctor at Harvard that said the B12 and folate are fundamental to the creation of serotonin, dopamine, and norepinephrine, and without them, the brain simply cannot regulate mood effectively. Dr. Joshua Rothman from Harvard, and he's right. But I will say that in SSRI, resistant depression, research has shown that using a B vitamin can significantly improve response rates. Okay. And it has two large trials here. Again, I love a large study. And B12 it's definitely a deficiency in older adults and different groups of people like vegetarians. It is. And so that's and also if people are taking metformin or proton pump inhibitors as well. So a lot of providers recommend a really high quality B complex supplement. All right. Now there are side effects with that. Okay. B12 can cause abdominal stress. It can cause nausea and a bitter taste. For some people, it causes them like to be irritable or overactive. And so difficulty concentrating, those are things there that can happen. And it does interact with a few drugs like anti-cancer drugs. You've got to be really careful with a few of those and some anticonvulsant drugs. And I caution this with bipolar disorder because the folate from the B12 can actually exacerbate mood shifts. All right. So you've got to be really careful there in that. Absolutely. All right. got a lot here. So magnesium, somebody brought that up, and I love magnesium as well. It's one of the most versatile nutrients that we have. It's got over 300 enzymatic reactions, and it directly, most of it, a lot of them, not all of them, directly affect the nervous system. It helps modulate NMDA. It helps calm GABA activity. And there's a lot of really good studies on there. It's generally safe for most people and tolerated well, except renal impairment. So, kidney function, you've got to be careful for that. It does cause some people GI distress, like nausea, abdominal cramping, diarrhea, things like that. But there are certain forms of it. If you take the magnesium carbonate or the chloride, the gluconate, or the oxide, those are more prone to cause those digestive problems. Now you got to be careful because at very high doses, there's acute toxicity for that, and you can get hypermagnesium, and that can happen especially with individuals with renal impairment, and because the kidneys just can't clear off that excess magnesium. And the symptoms of that are muscle weakness, confusion, hypertension, blood breathing, things like that. And then the treatment is that you give calcium by IV, right? And diuretics and sometimes hemodialysis if it gets really bad. But what I will say, so basically what I will say about that is with magnesium is like the other day I saw a supplement that was being sold for magnesium. And listen, I didn't look this up, but I saw the dose of the magnesium, and it was like a spray, like you sprayed it on your feet. And it was so high. It was absolutely so high. And I'm like, some people might not know that this is like external spray, and it would definitely have caused someone to have hypermagnesium. It definitely would have. And listen, I know that for the heart, a lot of times for heart rhythms, they will run bags of mag. So I have done that on individuals and to help stabilize the heart. So magnesium is definitely powerful. It's a powerful supplement, excuse me. But there is some, you gotta watch it with antibiotics like Cipro, tetracyclines, doxycyclines. It can compete with those and reduce their effectiveness. Okay, so you gotta space them out. Gabapentin, people are on Neurontin or gabapentin. Magnesium can lower that absorption by like almost 40%. And then there are some diuretics that it will cause like risk with and blood pressure medications. So you have to be careful. So that's the thing. Also, magnesium has mild anticoagulant effects. So if you combine that with other medications that affects blood clotting, you can increase your bleeding risk or your bruising risk. So you have to be really cautious about that, especially with magnesium. If you need to watch for bruising. Fish oil causes this mild, like anticoagulant effects, like fish oil does, turmeric does. So a couple of the things out there have that like low effect. So let's see what form of magnesium is best for anxiety. I'm reading this question here. I see gluconate is magnesium gluconate because it has like high bioavailability, and it's also like better on the tummy than it's less likely to cause like diarrhea. And so that glycine, it supports GABA, like your calming effects, and improves sleep quality. I think it's really beneficial for anxiety. Yeah, I would say that a lot of, as far as clinically, a lot of people recommend that one the most. But there's also magnesium taurate and magnesium L, and that those help GABA activity as well. And magnesium L crosses that blood-brain barrier. So that, I think that those 3 would be probably the best 3. Yeah. So absolutely. You just typed it in. Yes, exactly. Exactly. All right, let's keep moving here. Who's the doctor that spoke on B12 and folate? I will go back and get you that reference. Absolutely. It's in my slides back, so I can't move it. So let's move on to NAC. A lot of people take NAC. I take NAC. I think it's a really good one. There are a lot of data on this. It's not just about depression either. What I could say is I'm moving a little faster through these slides, but it's not just about depression. I think NAC is being studied for OCD symptoms, for substance use, and because it's where inflammation is driving these disorders, NAC helps with the inflammation, but it is deeply intertwined with mood regulation. Okay. Now, it does cause GI symptoms for people. It does. So you have to be careful there. And you can overdose on NAC. So you have to be really careful with taking NAC, but I think it's a really good medications. So it's a really good medication. But there's also some drug and disease interactions like nitroglycerin. People that take nitroglycerin, it can really lower and nitroglycerin is really people have chest pain, they take nitroglycerin, right? There's people that wear nitroglycerin patches because they constantly have chest pain. So that makes you hypertensive, and NAC can make you more hypertensive. Also, carbamazepine, it lowers those levels. So you got to make sure that you're careful with those. If you have asthma, it does have a higher risk of respiratory reactions. So you got to just use that with caution with people that have asthma. But there are a lot, if you look up NAC, it also has a lot of uses other than just depression. Absolutely. And so NAC is a really good medicine. It's the hype right now. I hate to say that. There's two ones that are the hype. We'll talk about the other one as well. I was hesitant to put this in, but they're ashwagandha. It's been used for centuries. Okay, it's been used for centuries, but there's been a lot of recent research on this, and people are reporting sleeping better. It does cause a drop in cortisol for people, which is cortisol is our primary stress hormone. And especially those that are like dealing with burnout or insomnia. And for most people, it's really safe and well tolerated. But the main caution is with people with liver disease. Okay, we have to be really careful there. Really worried about the liver. When we started this, I said kidney and liver were the things that you see a lot of are issues. And so you have to be very careful about this. I have people say I actually tried it as mildly calming. But I will be honest with you. My mother swears by this. Swears by this. So she does. She takes this, and of course, we make sure it's by one of the approved companies. But yes, everybody, I'm getting a lot of good things here. I just a few hours ago, really helped my anxiety cortisol. Okay, see, that's fantastic. That's fantastic. So I'm hearing wonderful things about this. Okay. Here's the problem. There's not as much research out there on it as there are the other supplements. So I was hesitant to even put it in. But because again, this is research based, right? I love research, but I'm hearing really great things from people, and I'm not hearing a lot of negative things about it. So that's great. That's really great. I had a question on how do I find professionals that have this level of knowledge with certs and acronyms for their name? Okay, no, there's good. That's a great question. So there is the American Board of Integrative Medicine. I think the American Board of Integrative Medicine, and that's a board certification for MDs and DOs. There's a couple other, there's the NDs, which are the naturopathic doctors. They usually come from an accredited program. They're trained in supplements, like in botanical medication and lifestyle interventions and things like that. There's, trying to think of some other, let me think of another one. I know there's there's certified nutrition specialists, which was going to be in the webinar with me today, but it's sick as well. Yeah. Yeah. So that's absolutely the meta-analysis. Somebody said what dose, 500 to 600. That was high though. That was a higher dose. There are much lower doses. Again, start low and slow, low and slow. Ooh, Lynn, you brought up something really good. You brought up a really good. So there's a couple cautions with ashwagandha we need to talk about. Avoid it during pregnancy. Okay. Avoid it during breastfeeding. And there is some caution in autoimmune conditions like lupus, MS, rheumatoid arthritis, because there is some research out there that talks about there could be some possible immune stimulation in that. So very good. I'm glad you brought that up. Yep. Very good. Excellent. And that is why I love discussion in here. So that's fantastic. All right, let's keep We're going to keep it moving. We got way more saffron. This is the one where I said there's a lot of hype around another one. This is saffron. It's not just like a culinary spice. It is gaining really serious attention, and it is in the mental health world. So I think it works well with this combination of mild serotonin reuptake inhibition, and it's got some really strong antioxidant effects, which can support that brain functionality and mood stability. So it's generally really well tolerated. It is, there have been allergic reactions with this because it's in a certain plant family. So there have been certain, and you don't want to take it during pregnancy because it can stimulate uterine contractions. And you want to caution taking in bipolar because disorder, because they're rare, but there are reports of like mood elevation. So yeah. How do you emotionally regulate? Sit them in front of a client. I love that. That's a great joke. That is a great joke. Somebody says, is it all autoimmune issues for ashwagandha? It was listed as all autoimmune conditions. Yes. Yes. So I'd be really careful with that because the possibility of immune stimulation. Great question though. All right. Next, let's go zinc. Zinc for brain health. We think of zinc as when you're sick, like during COVID. I took zinc every day. But I generally take zinc because I think it plays a bigger health in mental health than most people realize it. Because when your zinc levels are low, there's a link to depressive symptoms. All right. So it's generally safe. It's generally safe. Sometimes it upsets people's stomach. It does have a bit of a metallic taste in it. It can cause some headache. So you want to be careful. You take the normal doses. If you take it too high, that there can be some deficiencies with that. You want to be very careful if you're taking antibiotics like tetracyclines. Zinc binds to that gut, so it reduces the absorption of those. And same with diuretics. All right, they not a lot of zinc. You will lose your zinc if you're taking a diuretic, but it's generally safe and it's a low cost. But if you're taking a lot of it, if you're taking like 30 milligrams a day for more than a few months, you need to check your copper and iron levels. Okay. So you've got to be really careful with that. You want to always avoid prolonged high zinc. Okay. And especially with those with renal disease like kidney function, because if your kidneys aren't working well, you're not going to extract that zinc. Right. So you need to be really cautious with that. Moving on, probiotics. We talk about probiotics a lot for gut health, but when we talk about mental health, we can't really ignore the gut-brain connection that's going on there. And so probiotics can change how neurotransmitters are produced. They lower inflammation, they improve that kind of gut barrier integrity, and they can actually activate the vagus nerve. Probiotics are great. Probiotics are great. Yep, I love that. Yes, exactly. And they're generally well tolerated for people. So if for people dealing with like mood symptoms and GI symptoms like IBS, stress related digestive problems are generally really well tolerated. You got to be careful though. You do not take this if you have a central venous catheter. And then you do not take this if you have like pancreatic issues. Okay. Probiotics have been linked to severe pancreatitis. All right. So you've got to be careful of that. And then immunocompromised patients, like if HIV, people that are on chemotherapy, transplant recipients, those individuals have to be careful with probiotics. Okay. So just be careful there. There are products that have better strains that are backed by research. But if somebody's critically ill or if they're immunocompromised, you would watch probiotics. Okay. I would maybe steer clear from them. But there is really good information about probiotics out there for mood, for anxiety. All right. I'm going to keep moving along. Chamomile and lavender. Has anybody taken chamomile? Chamomile isn't just like a soothing tea that we think about. Like in clinical trials, it really significantly reduces symptoms and generalized anxiety disorder. So it's usually general. It's usually well tolerated individual. I love that people are like, yes, I do. Absolutely. So yeah. So chamomile is really good, and lavender. Both of them support relaxation. They can help improve sleep, and they can reduce the physical symptoms of anxiety. So it's really good. Avoid it in pregnancy. You want to use cautiously with bleeding disorders. Sometimes lavender, people use the oils, it causes contact dermatitis. And yeah, so you want to be careful with that. There is evidence. I would be careful with using it with young men. There's weak evidence out there. It's not real strong. Okay, so let me be clear about that. But there are some hormonal interactions. Like it's got like this mild estrogenic. It can cause. It can. There is weak evidence, but it's out there. So I have to tell you about it. That it can use in caution with hormone sensitive conditions. Okay. And it could, because it calms you, it can lower blood pressure. So if you're taking something for blood pressure that lowers your blood pressure, you just need to be really careful about that. But yeah, great things. And as I can see here, people really enjoy that. I'm getting public and private that you love it. And so that's really fantastic. That is really fantastic. All right. Let's see. Let's keep moving on. This one, the CME isn't talked about a lot. I'm not going to spend a whole lot of time on that, but I think it's a naturally occurring compound in the body. It is essential for producing like serotonin, dopamine, and norepinephrine. So some people use this in a monotherapy. Some people add it to SSRIs. But you got to be careful, okay, about this with the CME. It can trigger hypomania or mania in a person with like bipolar disorder or undiagnosed bipolar disorder. So you want to be really careful with it. I think there's some people say it causes serotonin syndrome. I watched something the other day from a physician who was like, there's not been one documented case of serotonin syndrome, but it does constantly say that there's a risk for it if you combine it with an SSRI, an SNRI, an MAOI, tricyclites, even tramadol, right? There could be some issues with that. So you got to monitor this one really closely. There are good evidence for it. But this is not like there's not a lot of data on long-term safety, so be really careful about this one. Let's talk about the dark side of supplements real quick. The This one carries a lot of risk. I'd like to get your feedback on that, Randy. That's an excellent suggestion. There these The first one, this one is being sold in online, it's being sold in gas stations, it's being sold in smoke shops, and they're marketing it as absolutely harmless. But it is not. It has alkaloids in it that act on opioid receptors. And so what it's causing is dependence, it's causing withdrawal. And we're talking withdrawal symptoms like muscle aches, insomnia, irritability, mood swings. It has causing issues to people's liver. It's causing tachycardia. Exactly. It's very, I think you said it fantastic. It is very bad. And people are going to rehab off of this. All right. And there is a new form of it now that's coming out and that is even worse. And so I would be remiss if I wasn't talking about supplements and didn't talk about some of the things that are going on with this particular one. It's really scary out there. And I'm going to tell you how bad it is. Okay. And there was a man, he was from the Czech Republic. He's 31 years old. Okay. He had a history of schizophrenia, and he stopped taking his Seroquel and he started consuming large amounts of this. Okay. And he was consuming cannabis as well. Okay. But he cut off both of his arms and his penis. All right. And he almost took off his left arm. All right. This is this is serious. Somebody just said in the public. You don't believe me. Okay. All right. I'm here. I can't make this up. Nobody wants to make up a story like that. All right. I promise you. So here we go. I keep all of my. So there you go. You read that. It's very true. Okay. And he was on this, which was sold at a gas station. And you're like, he's from another country. They're selling it here in gas stations. Absolutely. Absolutely. And so it's serious. Please start talking to your patients and clients about this. This is not something that people need to start taking. Next one. Listen, I would be lying if I didn't say that occasionally I enjoy Kava tea, Yogi Kava tea. You can buy it at like Walmart. But they're coming out with these Kava supplements that are high dose Kava, not what you get in a tea bag. They're coming out with these supplements of high dose Kava, and it gives you a bit. This is legal nationwide, but it can give these high dose supplements can give you a bit of a buzz. It's a sedative, right? It's like a muscle relaxant sedative, but it's bad for your liver. And so that's once a week I'll drink like kava tea before bedtime. But they're selling like these bottles of kava liquid that can really hurt your liver, and people are getting addicted to it. Yes. So Randy's, yes. Right in your, sorry, Randy, I didn't mean to say that. I'm trying not to say people. But yes, in that state, yeah, you can just walk into a gas station and sell it. It's terrifying. The next thing that I want to talk about is delta 9 and synthetic cannabinoids. This is, there's a, there's legal loopholes here, right? And then there's even worse synthetic cannabinoids like spice and K2 that they're outright illegal, but they keep reemerging, right? To skirt the law. And so the problem with these is they're unpredictable in potency. They can cause psychosis. They can cause cardiovascular events. They can be contaminated with things. And it's really unpredictable. And people are like, oh, it's just a derivative of marijuana. The dosages of marijuana, these are not like your high school marijuana or your parents' 70s marijuana. This is, you're talking where people did like marijuana 2 milligrams. Okay. Some of these things have 40 to 100 milligrams in there. It's causing real harm to people, and they are openly sold as well. Each town usually has 3 or 4 of these shops in specific states. So I just want to talk about this because people might be like, oh, it's a supplement. It's not. No, it's not. This is serious. Yes. So somebody said it has the same effect as methamphetamine. The benefits of kava is it does help with nerves. It does help calm you down. So modulates the GABA activity. All right. So it serves as a bit of a little sedative. Okay. And so it is a tea. It will help you sleep. It will help, but again, the only brand I recommend is Yogi and 1 tea bag. And on the Yogi thing, it says you can take 2 tea bags. I would never. But it does calm you down. It does. It absolutely helps calm down. Let's see. A family member of mine said they got a brain bleed due to marijuana. That's awful. That's awful. I'm so sorry to hear that. It's very dangerous. These are dangerous ones. Now we're going to go into ones that are not dangerous. Okay. We're going to go into like exercise. Everybody, we have heard this for years upon years, but there are some serious studies out there like the BGM network. They did a meta-analysis in 2024, and it literally said that the effectiveness of exercise, and this is like yoga, strength training, walking, it showed moderate reductions in depressive symptoms, and some of the effectiveness was compared and sometimes superior to psychotherapy and psychopharmacotherapy, especially in higher exercise intensities. Now, I want to be really, my opinion is, I know what the research says. My opinion is that therapy absolutely works and medication management works in severe cases, but this is what the study says. Okay, this is what the study says. There was one done by PCID. This was in 2020, a study that said exercise can be effective as medications for reducing depressive symptoms. And PubMed did another study too that showed that evidence was a valid evidence-based support treatment. Yes, I apologize. Absolutely. We're wrapping up right now. Bright light therapy. I think bright light therapy is wonderful. It's something that I use, especially like in the winter months. I live in North Carolina, but there are 11 trials. They all found that bright light therapy was effective as a treatment for non-seasonal depressive disorders as an adjunct for those, but it was very effective and almost as effective as compared to standard pharmacology for seasonal disorders, affective disorders. It's the first line recommended treatment for seasonal affective disorder. All right. We are wrapping up here. You guys have been so good during the way. I love the participation and the questions. It's fantastic. Mindfulness and meditation. Mindfulness and meditation are absolutely fantastic. How many of y'all encourage this with your clients or patients? I'm getting some privates. Yes. Okay. Yeah, absolutely. Absolutely. So thank you so much. Thank you. Thank you. Thank you. It is, yes, mindfulness is fantastic. And there are so many good studies on there, and they come out every year. And it is just, as far as evidence base, is through the roof. So if you're using this in your practice, you are a step ahead, and kudos to you. kudos to you for doing that. All right. So, well, listen, we are right at the hour mark. I went a little too long. I am sorry. I do appreciate you all being here. If you have any questions, I'm happy to stay to answer those. So, yes, Martian Flight and yes, DBT. Absolutely. Absolutely. My best friend is her biggest fan. So, thank you. Thank you. And thank you all so much for attending. I hope this was helpful as far as learning some of the supplements out there, learning some of the ones that are problematic on the market, but some that are really good. And I just appreciate your participation so much. So thank you, thank you, thank you for joining today. We do have ICANotes. If you don't use ICANotes, you can absolutely try it for free at ICANotes.com. I've got that there for you. We do have information on supplements in there. So we will send this webinar. So if you signed up for it and you're in it, I will absolutely send this out to you so you'll have a copy. But no, thank y'all. Thank y'all so much. So I love that you guys are in the comment section. And that was so amazing. So thank you. Thank you. Y'all have a wonderful day. Take care. Bye bye.